right, hello. Thank you all for tuning in to our Ask Me Anything session. My name's Dr. Anzeljc, and today I'm answering your questions about cosmetic eye surgery. So we'll get going right off the start here. The first question is, what is cosmetic eye surgery? Is it always the same type of surgery, or are there different procedures that fall under that description? In my view, cosmetic eye surgery or cosmetic eyelid surgery really falls under the purview of cosmetic upper and lower eyelid surgery, in which the goal is improving the aesthetics or appearance. And I also would group eyebrow surgery in that category as well, especially if it's done for cosmetic reasons. So we're mainly talking about brow lifting techniques, upper lid surgery, whether that be blepharoplasty to remove excess skin from the upper lid or raise a droopy lid, or lower lid surgery to improve the appearance, whether that be for puffiness or excess skin or a combination of both in terms of cosmetic eye surgery. Okay, so the next question is, what kinds of cosmetic procedures does Baptist Eye offer? If you don't necessarily need surgery, but you're interested in finding solutions for problem wrinkles around the eyes. So in addition to surgical options, which would include the things we just discussed, we also offer Botox and fillers, and we can do those around the eyes and the forehead and the face, which can certainly have an additive effect to surgery or be standalone procedures if you're not quite ready for those. What are the pros and cons of blepharoplasty? So the pros in terms of cosmetic reasons would be an improved appearance and a more youthful appearance of the eyelids, which in turn would hopefully provide some more youthful appearance to the face as well. Certainly the cons is just like any other surgery, there are some risks which would have to be discussed with your doctor. Can cosmetic surgery enlarge one's eyes? So the appearance of an eye can be enlarged cosmetically through what we call a ptosis repair, and there are two main approaches to that, as well as a couple of other approaches to a ptosis repair depending on the specific cause. But in terms of cosmetic surgery, there's one of two approaches to make the eyes look a little bigger. The lower lids could also be worked on for that indication, but that would be a rare occurrence. The next question I have is, I'm scheduled to get a blepharoplasty in a few months. How long does it take to recover? When can I go back to work or the gym? I typically tell my patients that you're going to expect to take about a week of taking it easy with no heavy lifting, swimming, or eye makeup. In terms of going back to work, it's very much dependent on what you do. If you have a job where you perform strenuous activities, you're going to take a week off of that in general. But if you're sitting at a computer or working from home, you might be able to go back as soon as 3 or 4 days after the surgery without problems. I always tell people to take at least 7 to 10 days off of the gym before going back after any blepharoplasty procedure. The next question is, I have a droopy lid. Should I see a doctor? Is it fixable? So if it's one lid or both lids, if it bothers you in any way, or if it occurred very suddenly, then I definitely would see a doctor. And yes, it is fixable in most cases. There are a couple cases in which there's an underlying cause other than changes related with age or trauma that need to be investigated and ruled out, and especially if they happen all of a sudden. So absolutely should see a doctor if it's bothering you and if it happens all of a sudden, and they definitely are fixable. What can I expect from eyelid surgery? What are the risks? So, eyelid surgery is relatively easy to do. It varies a little bit depending on what procedure is done, but typically it's performed in a outpatient surgery center, a hospital setting, or an office setting. Typically these are outpatient procedures where you go home the same day, no matter what setting you're in, and take it easy with some rest and some ice and ointment after surgery. In terms of the risks of surgery, anytime you have your eyelids operated on, you would have the risk of bleeding and vision loss, which is very rare and unlikely complication. The biggest risk in terms of surgery on the upper lids and the lower lids is slight asymmetry after surgery, which could be corrected and is a low risk. How can I fix my uneven eyelids? We briefly touched on this before. If your eyelids are droopy or uneven, it just takes particular attention during surgery to make sure that they are even. So that would depend on the underlying cause, why they're uneven, and how uneven they are. That is, of course, a risk of eyelid surgery, is that they could be uneven afterwards, but that can be addressed if that's the case. The next question is about brow lifting surgery. Is it permanent, and how much does it cost? I think the cost aspect would have to be discussed with your particular surgeon. The permanent or permanent findings of the brow lift, in general, no surgery is permanent when you're working with eyelids and brow, because we are fighting aging changes in the face and gravity and multiple other things. But they typically, I think, if you're looking at longevity, you'd be looking at 10 to 15 years of a benefit out of a brow lift. The next question is about pain. How badly does eyelid surgery hurt? So upper lids and lower lids are not typically painful. In general, all upper lid surgeries, typically it's Tylenol type pain. Occasionally, depending on what's done for the lower lids, you might need a little something extra for a day or two, but typically it's a Tylenol type pain, with most patients not even taking that and just using ice. What is the healing process after blepharoplasty? So after a blepharoplasty, you typically have an incision in your upper lid crease that you use ointment on that's prescribed twice a day for a week after surgery, as well as ice for the first 3 or 4 days to help with some post-operative bruising and swelling. I always tell patients to expect 2 to 3 weeks of bruising and swelling after eyelid surgery, but it is a range. So the bruising could be minimal and gone within a week or two, and the swelling could last up to 4 to 6 weeks minimally. But I always tell people generally 2 to 3 weeks is what to expect. The next question touches on blepharoplasty. Can you fix hooded eyelids without surgery? There are some non-surgical adjuncts for hooded eyelids. There are little crutches that are put in glasses or taping, but I don't find those to be very practical, although if a patient is hesitant to have surgery or a poor candidate for surgery, they can do some non-surgical adjuncts too, although they're not ideal. I am tired of wrinkles around my eyes. What do you recommend? I think that's a really hard question to answer from a patient without actually seeing exactly where the wrinkles are and what's going on. Sometimes it's something as simple as doing a little Botox, and sometimes it is a surgical fix. And sometimes there are filler options we could do depending on exactly where those wrinkles are. And so in my recommendation there would really be seek consultation with a surgeon or a specialist for that. Another question here is cosmetic surgery worth it? I think that's really in the eye of the beholder. The general thing is, how much does it bother you? Does the appearance of your eyelids really irritate you enough that you want surgery? And in that case, typically I'd say a patient would definitely say it's worth it. The next question is, does cosmetic eye surgery tighten, stretch skin on or around my eyelids? So typically, depending on what the surgery is, if it's a blepharoplasty, depending on the indication, you will tighten, stretch skin if it is loose. But if it's more of a fat issue where there's some puffiness to the lids, sometimes it doesn't have to involve tightening the skin, and sometimes you can use a different approach and just remove fat only, especially on the lower lids. If I get surgery to fix a droopy upper eyelid, how long does the procedure actually take? So I typically say most patients are having both upper lids done at once, and that procedure takes about an hour or less. If you work on one lid, you're looking at about half that time, so about 30 minutes on average per eyelid for a droopy upper lid. The final question is about medical necessity. I'd really like to avoid surgery for my upper lids, but at what point is it medically necessary? Typically it's going to be medically elective if your upper lids are getting so low that they're truly interfering with your peripheral vision and preventing you from doing daily activities, then they may be considered medically indicated. But that is really something that you would have to have an evaluation with the surgeon with to overall discuss. So we'll think that I think concludes our session today. Thanks for joining us. I hope I answered all your questions about cosmetic eye surgery today. We'll be doing more sessions like this on different topics in the future. Keep up to date with us on our Facebook page, as we'll be announcing future sessions there. And thank you, and have a wonderful day.